Hello everyone, I'm Dr. Gary Severance with Henry Schein, and it's always my pleasure to welcome you to Health Concerns in Dentistry featuring Dr. David Resnick. Today, Dr. Resnick joins us from Hotlanta, is going to cover some of the highlights of the recent OSAP meeting, as well as other health concerns, including the power of immunity and the triple threat that is coming our way. Dr. Resnick, welcome.
Thank you, Dr. Severance, for the introduction. We're going to have an interesting talk today about several things that I've learned recently that I'd like to share. Part of it really comes from the OSAP conference annual session that was held in Tucson, Arizona this past month. It was held in early June. I was there and did a couple of talks. But I also learned a great deal, and so I want to share a little bit of that information with you because it actually worked really well for me. One of the things that they had on the first day, which I thought was a really good highlight, was they broke out different forums. Helene Bednarsh and we started the Public Health Forum several years back, because there are a lot of federally qualified health centers that go to this conference. The Indian Health Service is there, the military is there. So you have all sorts of different people coming to this conference that is really just set on dealing with infection control and compliance. So you have a DSO forum for the big companies that are there, compliance and ethics and risk assessments for large group practices. That always includes infection control because that always can be a weakness. Dental assistant and infection control coordinator forum. I actually have one of the 50 people who is credentialed as an infection control coordinator on my staff. I am so very proud of that. Only one of 50 in the United States, so really a great job there. On the Public Health Forum, we looked at that there's more to infection prevention than just hand washing and water lines and autoclaving. You really need to know your patient. So we talked about EMR, electronic medical record, and electronic dental record, where they work together in one environment, and how that can help you deal with people who may be at risk for bad outcomes, say an uncontrolled diabetic, which is something that we do see, or over-controlled diabetic where they need some sugar. So things that we just normally see in a dental setting. There's an educator forum, which was looking at quality improvement and infection prevention in dental education, because we all know that whether it's a dental hygiene school or a dental school, we have a lot of operatories, there's a lot of aerosol, there's a lot of things going on. There's a corporate forum, which was understanding the accreditation process and helping customers have a successful survey. So there's Council on Dental Accreditation surveys, there are Joint Commission surveys, there are other surveys that the FQHCs have to go through. So how do we actually get to good accreditation process and make it easier and follow the guidelines? And then there are a lot of consultants who work with OSAP, because it's a membership organization, and utilizing social media to communicate infection prevention and control. I do a little bit of that with a website, an organization, HIV Dental Alliance, or hivdent.org, where we're on Facebook, we do things on Twitter, and of course we're on the internet just to help share information. The biggest lecture that we have every year is the John Zapp Global Lecture, and it was done by a remarkable person that I actually had an opportunity to spend time with before her presentation. Regina, she's Afghan-American writer, educator, social activist, and politician. She's a well-known as an advocate for women's rights in Afghanistan and is engaged in several different projects. She was an education minister in Afghanistan until the Taliban took over. Then she actually had to come back to the United States. But listening to her story and then sharing some of my experiences working with people with HIV, it was, to me, the highlight of the whole conference. And this was at a reception. I was actually on a Georgia Board of Dentistry call during her actual presentation, but I've watched it on video, and you can still get these OSAP presentations and watch on demand. So I would highly recommend that. She was a remarkable human being who is raising money to go back to Afghanistan and help women's issues once more. Just a true hero. So one of the things that happened on day 2, we have had an outbreak of non-tuberculosis mycobacteria or Mycobacterium abscessus in Georgia. We had one in 2015. There was one in California around the same time, but there was one that happened very recently, and as a member of the board, I didn't know what was going on. Their CDC really wasn't releasing much information because of course, I have friends and colleagues there. Didn't really get much from our health department, and so I was very surprised that this whole case was presented at OSAP. So I'm going to share you some of the highlights on what we now know that I honestly didn't know until this conference. So of course, we're worried about waterborne pathogens. We know that they're commonly found in the environment. They are able to survive at low levels in potable water. They're frequently associated with building plumbing systems, and I think that's a key. As many dental offices are opening, and some maybe in older buildings, we have to look at the plumbing systems. The organisms that we're looking at, like Legionella, Pseudomonas, and Mycobacteria, they're the most waterborne that we deal with. We do just a heterotrophic count to see where we're at. So that's that wanting to have our colony forming units less than 500. So if you look at the waterborne pathogens that we see in dental facilities, there's Legionella, which you know it's in water, you can get it inhalation. There are two kinds of illness that come from this. One is a more mild illness, Pontiac fever. Legionnaire's disease is a very, very serious illness, and this is not the easiest thing to grow out in the lab. Pseudomonas is in soil and water. You can get this through inhalation or contact. It can be pneumonia or skin infections. It's susceptible, and this actually shows up in routine lab analysis. And then mycobacteria, or the non-TB mycobacteria, which is in soil and water, can be through inhalation and contact. It causes issues in the lungs, skin, soft tissue infections. It is not very susceptible to the biocides, and it is difficult to identify. What we first can do is look and see if we have an AFB positive test. That will give us an idea that there's mycobacteria. So in March 2022, CDC identified a cluster of suspected non-TB mycobacteria infections, 13 cases, ages 5 to 10 years old. Cases were identified between May 2021 and November 2021. It was a single dental facility located in the Atlanta metro area. No specific patient isolates have been identified, so that's why when I was asking for the cause, they're still having a hard time figuring out the cause. In all cases, surgical procedures were required to resolve the infections. So we're talking about young people who are having pulpotomies. That's what's happening here. The organism is in the water, and that is causing these other more serious issues that are involving surgery. This particular clinic has 10 dental operatories, has a pressurized bottled water system, 4 chairs for exams and hygiene, 6 chairs for procedures. They had a total of 15 sinks, including chairside, sterilization room, bathrooms, break rooms, etc. But they had 7 dead legs, which is an area that was plumbed out for additional treatment rooms that was not built, but water still goes into these dead legs. They're just capped off. And so that's another area that is of concern when you're building out a new clinic. So the heterotrophic count, that's when we do our colony forming units. So we want them to be less than 500. 93% of the water samples that were taken, or 55 out of 59 potable water samples, were actually positive. 32% had greater than 500 colony forming units per ml, and you can see the range was from very low, which will be fine, up to 24,000 colony forming units. When they looked at Mycobacterium, 95% were positive. 56 of the 59 samples had Mycobacterium in there. This is that non-TB Mycobacterium that has caused problems in children, again, in 2015, 2016, and now we have a case in 2021. The Department of Public Health was informed. At this point, the facility was no longer able to care for patients, so it was closed down. They brought in a water treatment company. They flushed for a week and treated with monochloramine system. So again, when we go to our heterotrophic counts, what we normally look like, 42% or 23 of the 55 water samples were positive. For heterotrophic bacteria, 5%, which is a lot less, had colony-forming units greater than 500. Mycobacterium, again, a lot less, 38%. 21 of the 55 water samples were positive, and you can see what the different ranges. I think one of the points that the presenters were trying to make is that you can have less than 500 colony forming units, but you can be in that 500, you can have something that's very dangerous like mycobacterium. So looking at both might be the future of where we're going in dentistry, especially in pediatric programs where you're doing surgery. I know that some states have changed. I think California now that says that you need to use sterile saline when you're doing pulpotomies. We haven't done that in Georgia. What we did here is we have added 2 hours of continuing education on infection prevention, with one of the hours having a good focus on waterline issues. So we're trying to be proactive so we can prevent these issues from occurring in our children. I think that's the key here. The water treatment continued for 8 months, so the office is still closed. Ongoing flushing and continued treatment with the monochloramine system. If you look at the heterotrophic counts, now it's just 2 of 17 water samples. 0 had colony-forming units greater than 500, so that was excellent. Even better news was that 0 of the 17 water samples had mycobacterium. After these results, they needed to have 3 more consecutive clean results in order to resume their practice. So you can see that it's an outside source, and we have to take every step we can to make sure that our water lines are clean, especially when we're treating the pediatric patients, but for all patients, I think it's important. My patients are immunosuppressed. I want to make sure that I'm offering a safe dental environment, which is why we've been testing the dental unit water lines for some time and treating them using the manufacturer's instructions for use. Always follow what the manufacturer tells you to do. The reason, again, why I bring this up is what happened on the first case that we had in Georgia for 2015, just to show you some of the issues that show up if we do have this non-TB mycobacterium in our water lines. This is just an example of a child who had facial swelling and non-healing extraction sites after routine dental treatment in a healthy child. There were 23 other patients with similar presentation from the same practice location. The clinical manifestations, lymphadenitis in every one of the patients, pulmonary nodules in 37% of the patients, osteomyelitis in 48% of the patients, facial swelling in 60%, fever 5%, permanent tooth loss almost 50%, hearing loss greater than 50%. Vascular access malfunction in 64%, facial nerve palsy in 29%, and drug reactions or a rash in 25%. They also had to be placed on an IV medication, which is kidney toxic. So there were several things that we had to take into consideration, and it took a long time to try to address the wrongs of this dental unit waterline concern. And it's not just dentistry that deals with this. Some may have heard me talk about this before, where Mycobacterium abscessus was found in a cluster of cardiac surgery patients and related to a commercial water purification system. Non-TB mycobacteria are water avid pathogens, as we've talked about, and they are associated with nosocomial infections. To describe this whole thing was looking at what happened with this particular outbreak of Mycobacterium abscessus in cardiac surgery patients. So we're not talking about dental, we're not talking about pulpotomies, we're not talking about extractions of primary teeth. What we're really talking about here is people who had cardiac surgery, and there was a cluster in Brigham and Women's Hospital in Boston, a very, very famous and renowned hospital system in the United States. It occurred in 4 cardiac surgery patients. Whole genome sequencing confirmed what we were looking at. The patients were admitted. So what did they have in common? The patients were admitted during different periods of time, but to different rooms on the same floor. There was no common operating room, ventilators, heater cooler devices, or dialysis machines. So the only thing they had in common was that they were on the same floor and they were at different times. Environmental cultures were notable for heavy mycobacterial growth in ice and water machines on the cluster unit, but little or no growth in ice and water machines in the hospital's 2 other inpatient towers or in sink and shower facilities in any of the hospital's 3. So it happened to be in an ice machine and a water machine that caused this cluster. So that was just a little bit of a review of Mycobacterium, the non-TB Mycobacterium. Highlights of day 3, implementing an antibiotic stewardship program. I've actually had one of those in place for some time. I do serve as the dental rep to the Department of Public Health's Antibiotic Stewardship Committee. All of our prescriptions actually go through one electronic medical record. So you can track your own if you're writing them through an electronic dental record, electronic medical record. I get every month, I get a report of every antibiotic that was written by staff in my program, as well as every opioid that was written in my staff by program. And then I have the residents go through and take 5 cases each to look and see if the antibiotics were done appropriately, if pre-medication was done appropriately or non-appropriately, how many opioids are prescribed is another aspect we have in there. And so these are really important things that we can do. We want to try to eliminate the amount of clindamycin we're writing because it causes C. diff, which keeps people in the hospital. We want to make sure that we're not over-prescribing. Dentists are about 10% of who writes antibiotics in the US. I wish I could have gone to the Learn How to Conduct the N95 fit testing. We get fit tested every year at the hospital. It's part of OSHA guidelines. And we have to be fit tested if there's a brand change. And so that's caused a bit of a conundrum. We were fit tested on one brand, but the Oral Health Center, the staff here and faculty, they much prefer a different brand. So I am trying to get the hospital to conduct an N95 fit testing on the brand that we are using in the oral health system, which was allowed previously at Grady. So that is something I'm working on now. And then emerging infectious diseases, impact on the safest dental visit. We were talking about different things like I'm getting ready to talk about, or Mycobacterium abscessus, or infectious diseases that we are seeing in the environment, maybe not necessarily COVID, but there was a problem with Pseudomonas in eye drops that caused blindness. There are all these different issues that were going on. And so actually that was my lecture that I got to do. I had a fabulous time giving that presentation. I had someone in the audience who was my foil, which made it a lot of fun. Dr. Don Cohen is a great guy, and I appreciate his playing along with me during that presentation. This is something that is absolutely brand spanking new. A health alert went out about tuberculosis disease associated with suspected contaminated viable bone matrix material used in surgical and dental procedures. And I think that's the key. This time we're involved in it as well. CDC is working with state health departments, the FDA, and Azio Biologics, who makes this product, to respond to a new cluster of TB cases linked to suspected contaminated viable bone matrix material, predominantly used in spinal fusion. And if you followed me over these years, you know I've had a few of those, and dental surgeries, and you might not know I've had some of that. So my first question when the CDC called me was, is it in Georgia? And the answer was no. I don't know the states where this material is, but it's by Azio Biologics. There is a voluntary recall on this material. You can take a picture of the slide or when you're watching YouTube so you can see what the lot number is. And the expiration date was November 2nd, 2024. On July 13th, as I mentioned, the manufacturer proactively issued a voluntary nationwide recall of the product from this particular lot. The cases appeared to be linked to one product lot used in surgery and dental procedures, were sent to 7 states between February 27th and June 2023. I do not know the 7 states. That information has not been shared at this point. All facilities and states involved, though, have been contacted, and all unused units of this product have been sequestered, meaning they have been removed from inventory and will not be used. TB is caused by Mycobacterium tuberculosis and can cause severe disease and even death if not treated. Patients who received V-bone, which is what they use for spinal surgery, or allo-os, which is used in dental surgery from this lot, should be clinically evaluated as soon as possible for postoperative infection as well as TB disease. There were 43 units of V-bone that were from the same donor that were shipped to hospitals in those 7 states. There were 7 units, that's all, of allo-os made from the same donor have been sent to dental offices in 4 states. Again, I do not know what the 4 states are, but I'm sure the states have contacted the recipients of these materials. CDC recommends that patients who underwent surgery or dental procedures involving this lot receive a complete diagnostic evaluation for TB and begin the 4-drug treatment for presumptive diagnosis of drug-susceptible TB disease, even in the absence of signs or symptoms. So really, if you have this material, they want you to go on active TB treatment. Healthcare personnel may have been exposed, and that's something that I'm always concerned about. I will tell you, in my practice, we're still using N95s. We don't want to get out of practice, even though this is a low time for respiratory diseases. We were trained that, and when we're generating an aerosol now, we're keeping all of our steps in place. I think, as I've said many times, my primary job at this point of my career is to ensure that my patients and my staff all have a safe outcome. It's also important that we identify and assess all exposed healthcare contacts to TB infection and disease. The CDC will provide additional guidance as more information becomes available. So this actually came from a healthcare quality and worker safety information update that was on July 18th. There was an update that actually came out this week. So healthcare providers should continue to work with their respective health departments. TB programs, we still have them. I'm working with the CDC's TB elimination project just because I have a colleague who works at our infectious disease program. And we're looking for, again, for evaluation and treatment. Treatment should be coordinated with infectious disease and TB experts. So not just your family practitioner. We really need to get these patients who have been exposed to TB expertise. And there is another link that you can click on here on the TB Centers for Excellence in Training, Education, and Medical Consultation. So we want to make this as a serious issue. Yes, it's only affecting a certain amount of patients, but it is important that as part of the healthcare community that we stay up to date with what I would call an emerging, it's an old disease, but it's an emerging infectious disease because of it's in these allografts. And I think that's important. Most of the products out there are safe. This is just one lot. And it hit those 7 states for the medical side, 4 states for the dental side. And I know they're taking active steps because we have people who, there was an issue that happened in 2021. So this is not the first time. It was again with spinal surgeries. So we have people who are experienced managing this at the CDC in different parts and hospitals across the US. So I put up some resources here just in case you're concerned. Again, I don't know the states, but they are releasing information gradually and more rapidly than one would expect because of the nature of the illness. So really, they're doing a great job in trying to update things as they happen. So for instance, I normally do update my slides on the day that I'm presenting, and I updated this morning just to include the number of states that had been impacted so everyone doesn't have to be concerned. I did want to do a little bit of an update on respiratory diseases. Maybe you've heard lately where are we with a triple threat that's going to happen this fall and winter of COVID, which it's not over. I want you to understand that, yes, we are in a very pleasant lull. And yes, deaths have sort of flattened out, and that's fabulous news, but we are starting to see some signs of increase. And I think that possibly because of the extreme heat that's hitting many parts of the United States, people are indoors more than they normally would be at this time of year. So where are we with RSV, influenza, and COVID? We've seen a milestone. I mean, I love it when I actually get the opportunity to share positive information. The total number of Americans dying each day from any cause is no longer historically abnormal. During the worst phases of COVID, during the initial variant and then the Delta phase, the total number of Americans dying each day was more than 30% higher than normal. So we had a lot of people dying. You could hear the stories about the nursing homes. You would hear different areas, people getting applause on their way to work as people were sequestered in their homes, etc. For long stretches in the past 3 years, the excess was above 10%, but during the past few months, excess deaths have fallen to zero. So that is wonderful news. So we are literally at our baseline. It's taken us a long time to get there. So what are we going to do with the upcoming fall and winter season, I think is important. Again, this is just a data slide showing you the percentage of deaths right up to June 17, 2023. The source is the CDC. And you can see that on the top bar is 50% above normal. We had sometimes during 21 where we were over 40%. Again, in 22, in probably that July area. 23 has been a much better year. And as you can see, we've been hanging on around that zero number for some time, and that is very positive news and something I like to share. Why? There's probably three main reasons. First, about 3/4 of the adults in the United States have received at least one vaccine shot. Second, more than 75% of Americans have been infected with COVID, providing some level of natural immunity from future symptoms. About 97% of adults fall into one of these two categories. So either you've had COVID or you've had at least one vaccine, which is maybe why we're seeing many less deaths. Third, post-infection treatments like Paxlovid can reduce the severity of symptoms, and they became widely available last year. So we have a medication that can treat. We've had people that have been vaccinated, received one shot, and a lot of people, 3/4 of Americans, have actually had COVID. And so I don't have to tell you the symptoms. You've lived through the symptoms. I'm one of those people. I did not get COVID, and I have tested for it, and I guess that's a blessing. I might have the right gene set or whatever, because they're talking about susceptibility related to blood types and different genotypes, and so there's a lot of information out there. A little bit more than I want to share today. But not every death is preventable, and this is by Dr. Ashish Jha, who was the White House COVID coordinator. We're at a point where almost everybody who's up to date with their vaccines and gets treated, if they have COVID, they rarely end up in the hospital and they almost never die. It's also true for high-risk patients like mine, and I think that's important. Also like older adults, like my mother-in-law, my aunt and uncle, like Dr. Jha's parents who are in their 80s, and people whose immune systems are compromised. Even for the most, not all, but the most immunocompromised people, vaccines are actually still quite effective at preventing serious illness and death. There's been a lot of bad information out there that somehow if you're immunocompromised, the vaccines don't work. Actually, if you are immunocompromised, it's very important that you do stay up to date with your vaccines. It doesn't mean that you will die if you don't get them, but we had a lot of sick people at my program, and now we're very, very seldom having to deal with that, which is great news. COVID's toll has not fallen to zero. The CDC's main COVID webpage estimates that about 80% people per day have been dying from the virus in recent weeks, which is equal to about 1% of overall daily deaths. So again, it is not over. These 80 people per day could be family members, they could be relations, they could be patients, they could be staff people that you work with. Every life is an important life. So if you look at the daily updates and you look at deaths, that number continues to go down. But what bothers me is the hospital admissions are tending to go up. And there has been a 10% increase in recent weeks of hospitalizations due to COVID. So again, it is not over. We are at a wonderful time where we're with family, we're with friends, we're hopefully near a pool, we're in shade, we're in air conditioning, where we're not as much at risk, but there has been an increase in hospitalizations. If you look at the deaths, I always like showing some graphs. Here are some graphs of COVID-19 deaths during our peak times. where there were weekly deaths were well over 25,000. Now you can see the number is down to 80, and it's so small, and it was heading in the right direction. So great news as far as we're talking about deaths from COVID. Provisional deaths by week, so you can see how the numbers have grown over a period of time where we've reached over 1 million deaths, 1,135,364 as of July the 15th. But it's plateauing at this point. Good news. Hospital admissions by week, you can see that there have been periods of time when hospitalizations were just literally almost off the chart. Now you're seeing that they're ticking back up. It's still a small number. We're still doing well, but we're in the main part of the hottest part of summer right now. So we'll see how long this lasts. There's a lot of travel going on, a lot of European travel, a lot of travel within the United States. So we'll see. But right now, we're just seeing it start to tick back up a little bit. Spread of all three of these viruses is low, as I mentioned, but the CDC's been beginning to see increases in COVID testing, COVID-related emergency department visits, and the decline in COVID hospitalizations I mentioned has stalled. It's actually being an increase. It's caused by the Omicron XBB subvariants, or the most prevalent form of COVID. They tend to form an upper respiratory tract infection, which is why you're not hearing anything about respirators, etc. The World Health Organization has identified a new version, that EG.5, which is also in the United States, and it's a rising prevalence around the world. It's unclear of anything what this means. It does not mean it is a more serious illness. They have not seen that at this point. The WHO noted there's no evidence that it causes a more severe illness. Our new CDC director says so far the virus remains susceptible to our vaccines. So I think that that's good news, but we have to still be a little bit careful. And I think in the dental office, generating the amount of aerosol we do, I think it's always important to try to address that. For the first time this fall, people in the United States will have access to 3 different vaccines for RSV. And there also is a new monoclonal antibody injection for babies. And like I said, there's a 3rd vaccine that's up for approval. We already have 2 that are approved, and they have the potential to drastically reduce the cases of the virus that hits infants and older adults the highest. And regretfully, I think gratefully at this point, I have made it to being an older adult. And so I will get my RSV vaccine. I actually have unusual. I have a doctor's visit today, and we're going to talk about vaccinations and when I should get mine. Unexpectedly severe surge of RSV infections in late 2022 overwhelmed our children's hospitals. I don't know how you can forget some of the pictures that we were seeing of these children's hospitals overwhelmed with babies and young kids whose immune systems had not been exposed to the virus during the lockdown. Hopefully we won't be there. We can get our children vaccinated. Our newborns can get this monoclonal antibody injection, which, unlike a vaccine that prompts the body to make its own antibodies, the injection works by delivering antibodies against RSV directly into the bloodstream. So it gives you an added level of protection for your infants and smaller children. So we're not there yet. We have to worry about what we're going to see in our winter and fall. This was just an overview of some of the wonderful things that happened at OSAP's convention. A look at what happened with these non-TB mycobacteria in our latest outbreak in Georgia. What we're seeing as far as maybe some issues with some of the bone materials we're using in dentistry, but definitely on the spinal side. We have experts from all over the United States working on this issue at the present time. And right now, it's a great time. Again, there's a little bit of an increase in hospitalizations, but it's a great time to spend time with family and friends and do some travel, get out and have a happy and long summertime. So I'm going to turn it back to Dr. Severance as always, and he'll let us know when our next health concerns in dentistry will be. It's always a pleasure to have this opportunity. Dr. Severance, I'm turning it back to you.
Always great to see and hear from you, Dr. Resnick. Thank you for that up-to-date information. Thank you for attending, and please subscribe to this series by clicking the subscribe button below. And if you want to be notified of any premieres, click the bell icon. If you have any questions, concerns, or ideas for a future episode, please email us at webinars@henryschein.com. We'll see you next month, August 25th, for the next episode. And until then, please stay safe, stay cool, and stay informed. Thank you.